Good afternoon. I wasn't certain that the woman on my right who needs no introduction, the Commissioner of Health, Judy Persicelli, would be with us because she just literally walked out of a budget hearing. So great to have you as always with us. And that was a 3.5-hour session, so hats off to you. And to your right, another familiar face, the Department of Health's Communicable Disease Service Medical Director, Dr. Ed Lifshitz. Ed, great to have you. To my left, a guy who needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. We have the Director of the Office of Homeland Security and Preparedness, Jared Maples, with us. I'd like to start today with a couple of and thank you for your patience, by the way, starting a little bit later today. I want to start with a couple of non-COVID related items. First, tomorrow is the first day of Hispanic Heritage Month, the annual celebration that runs from September 15 through October 15. Across New Jersey, Hispanic Heritage Month is one of our most colorful and meaningful celebrations. And as with so much else this year, we will have to celebrate a little differently. I, for one, will especially miss not just going around the state, but our gathering every year of our state's Hispanic leaders at Drumthwacket. However we celebrate, the contributions of our Latino communities are unmistakable and provide so much of the color that makes up the wondrous and vivid tapestry that is New Jersey. I see some of the best of New Jersey, and I see some of the best of America. This is who we are as New Jerseyans. We are diverse. We don't all speak the same language. We came from different places. We have different stories. But here, notwithstanding all of that, we are one family. And at a time like this, that's something worth celebrating. So happy Hispanic Heritage Month. Que Dios te bendiga. Next, on Friday, I announced, and Pat was deeply involved in this, that 10 firefighters from the New Jersey Forest Fire Service would be deploying along with 3 fire engines and an additional support vehicle to California to help state and local firefighters battle the worst wildfires in recent memory. I'm proud to today announce that all members headed off on Saturday or have arrived safely in California, and their arrival is not a moment too late as numerous fires continue to burn out of control. We wish them nothing but the best as they tend to the task ahead of them, and we pray for their safety and look forward to their safe return home to their families and friends. It's worth noting that the western wildfires have burned in total acreage, Pat, the size of our entire state, which is extraordinary. More than 24 Americans have lost their lives. Thousands have lost their homes, and in most cases, along with their homes, almost everything they owned. Let that sink in just for a moment. With everything else going on around us, these families are now confronted with the horror of these fires. This is why I am so proud that we can assist. As Americans, we are all in this together, and we stand with our brothers and sisters in California and elsewhere across the West. And it isn't just the West. Pat and I were just discussing earlier, and I know he'll address this. We want to be the guys that are always there for our fellow sister and brother states, but we've also got to make sure we've got the assets that we need in our own state, given, in particular, in our case, the potential for storms. Less so, thank God, forest fires. So I know, Pat, you'll talk a little bit more about all of the above. Judy, with your blessing, let's look at the overnight numbers. Today we are announcing an additional 346 positives for a cumulative total of 196,968. Positivity rate for tests recorded on September 10th was 1.82%. That's a good number, down a little bit over the past couple of days. Statewide rate of transmission currently stands at 1.06, and Judy, you predicted this last week. It got as high as 1.1, and then it started slowly drifting a little bit, still over 1, but drifting generally in the right direction. In our hospitals, there were 216 COVID positive patients being treated as of last night, an additional 204 awaiting test results, so for a total of 420. Of these, 91 were in intensive care, 41 ventilators were in use, and today we are reporting with a heavy heart 3 additional fatalities, bringing the total of confirmed deaths to 14,245. The number of probable deaths remains unchanged for today at 1,789. Of those 3 deaths, Judy, I've got 1 from September 10th and 2 from September 9th. And again, this is at the risk of apples to oranges. Our hospitals reported 14 deaths yesterday, but again, those are not confirmed COVID causes, so they are not included in those numbers. That's just to give you a spot sense of what it looks like in our hospitals. Let's take a few minutes, if we could, to remember 3 more of the New Jerseyans this pandemic has taken from our statewide family. We'll start by remembering Richard Gould, a longtime resident of Woodbridge who we lost at the age of 81. He was born and raised in Brooklyn and served in the United States Marines from 1956 to 1959. Patty looks like a Marine, doesn't he? Richard moved to Woodbridge in 1961 after he and his wife Marie Ann were married, and it was there that they would raise their family. Richard worked in the alarm security industry and was the owner and operator of State Alarm Company in Edison for 20 years. Last year, he received the Pioneer Award from the New Jersey Electronic Security Association. But it is Richard's community service that stands out. He was a member of a Woodbridge Fire Company number 1 for 48 years, served as Township Fire Commissioner for 15 years, and took special pride in his work with the Fire Prevention Bureau. He was active in St. James Catholic Church and a member of the Knights of Columbus Council number 857, as well as to the Corporal Reinhardt Detachment of the Marine Corps League. He is survived by Mary Ann after 59 years of marriage, and their sons Rick, and I had the great honor of speaking with Rick at the end of the week, and Thomas, who I believe is in Colorado, and their wives Eileen and Amy, and 5 grandchildren. He also leaves 2 brothers and countless family and friends. In all, Richard had 10 godchildren. And by the way, as his son Rick said to me, Judy, 6 members of their family were COVID positive, including his wife Marie Ann. Thank God, as far as I can tell, based on our conversation, they're all okay, other than their hearts are broken by Richard's loss. So we thank Richard for his years of service to his community and to our nation, and may God bless and watch over him. Next, we recall Marie Dykstra Lilore, who passed away 2 weeks short of her 95th birthday. She was born in Jersey City and in 1944 married a young soldier named Leonard Dykstra. And after his return from serving in Europe in World War II, where, by the way, he was injured during the Battle of the Bulge, they eventually settled in Hasbrook Heights. Sadly, Leonard passed in 1984. Marie found a new love, a widower named Ralph Lilore, and they were married in 1988 and stayed together, making their home in Rutherford, and then in an assisted living facility in Woodcliff Lakes until, sadly, Ralph's passing in 2017. In her Hasbrook Heights days, Marie kept busy managing the active schedules of her children, Susan, Paul, and Peter, while volunteering at Hackensack Hospital and teaching after-school religion classes at Corpus Christi Roman Catholic Church. Her sense of community did not dim upon moving to Rutherford, and she was both an active member and volunteer at the KIPP Senior Citizens Center. So Marie now leaves behind her son Paul, and I had the honor of speaking with him at the end of the week. He's in Paramus. Her son Peter and their families, 4 surviving grandchildren and 6 great-grandchildren. And this is not the first cross that Marie has had to bear. Her daughter Susan passed away in 2006, and her son Peter, who I mentioned is in Georgia, fell victim to an infection and is paralyzed since 2017. But they march on. Her family was her rock through thick and thin and to the end. May God bless you and watch over you, Marie, and may God bless and watch over your family. Finally, today we remember Lymas Robinson, known to many as Rob. He was born in Harlem and served with the Army in Vietnam. In 1977, he and his wife Lilore moved to Englewood and opened what Lilore called Englewood's first black-run bakery A&R Bake Shop, with Rob working behind the scenes. In the 1980s, another move took them next door to Teaneck, where they raised their children, Stephen and Felicia. He was deeply involved in the community, and Lilore wanted me to make sure I said that he was president of the Voorhees Street Association. Rob was a bus driver for several years before an opportunity arose to join the police force in the emergency department at University Hospital in Newark. He would earn the Public Safety Department's Grand Corton Medal when he stepped in to save the life of a fellow officer who had been jumped by a man while at the hospital. Rob now leaves behind Lilore, and I had the great honor of speaking with her on Friday. He passed the night before their 57th wedding anniversary. Son Stephen and Felicia, who I also had the great honor of speaking with on Friday. His daughter-in-law Natalie, and his beloved grandchildren Jayla, Ryan, Kyle, and Dakota. He's also survived by his sister Thelma, as well as a brother-in-law and sisters-in-law, nieces and nephews. Rob was 80 years old. And again, to you, Rob, may God bless you and watch over you. And may every member of our New Jersey family who has been lost to COVID-19 be blessed, and their families find comfort in their memories. May we never forget those who we have lost. They are our friends, family members, and neighbors. And may we always remain mindful of the steps we can take to slow the spread of the virus and to save lives. Next, I want to acknowledge another of the small business leaders who has partnered with the New Jersey Economic Development Authority to remain strong during these unprecedented times. On Friday, I had the great pleasure of checking in with Kyung Sung. Kyung goes by, she wanted me to call her KJ Sung, the founder of Cherry Hill-based Computer Connections, Inc. Kyung's flagship product, Wind Cleaners, has been the leading software management system for the dry cleaning industry for the past 2 decades. It's been continually updated and improved as technology has improved, and continues to set the standard, and is in use not just across the United States, but in businesses around the world. To keep her business open, KJ worked with the EDA to receive an EDA small business loan. This will ensure that Computer Connections stays ahead of the competition, and Wind Cleaners remains the industry standard. So KJ, thank you, or I should also say, Gamsahamnida, for making New Jersey the home for your business, and we look forward to your continued success. And finally, I want to close by recognizing a hometown hero who the First Lady had the pleasure of working with recently, and I had the great honor of speaking with a few days ago, and that is Carlos Roldan, the head of Catholic Charities Food Pantries in Paterson, New Jersey. Prior to the pandemic, Carlos and his team of volunteers would provide food to between 5,000 to 7,000 residents in a typical month. By April of this year, the demand had doubled. In May, it tripled. In June, July, and August, they were serving nearly 25,000 children, women, and men. Over these months, Carlos has overseen the distribution of more than 100,000 pounds of food. Like everyone associated with Catholic Charities, Carlos is working tirelessly to end hunger, and his efforts have never been needed more than now, when countless families are turning to him to put food on their tables. So to you, my friend Carlos, and everyone at the pantry in Paterson, thank you so much for your selflessness and kindness. You are truly an inspiration. Keep up the great work. And I will send those same regards to each and every one of you working every day to keep your community safe and to help us beat this virus, keep people fed, secure, and strong. Thank you, folks, for all that you've been doing. Stay at it. Nobody does it better than New Jersey. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. As we enter the fall season, we are also moving into the flu season. This year, we are preparing for the possibility of a twin-demic, a severe flu season and a resurgence of COVID-19, which could strain healthcare resources. Therefore, this year, more than ever, It is important that everyone 6 months of age and older get vaccinated against the flu. The healthy people target for flu vaccination is 70%. Nationally and in New Jersey, less than half of the eligible population received the flu vaccine. This leaves many people vulnerable to the complications of the flu. Getting a yearly flu vaccine helps to protect you and those around you who are more vulnerable to serious flu illness, like babies, young children, and older people, and people with certain chronic health conditions. The flu vaccine will not protect you against COVID-19. However, the vaccine can reduce flu illnesses and hospitalizations. September and October are good times to be vaccinated. This year, the CDC is encouraging residents to get vaccinated by the end of October. It takes 2 weeks after vaccination for antibodies to develop in the body and provide protection against influenza virus infection. That's why it's best to get vaccinated before influenza viruses start to spread in your community. However, residents can be vaccinated any time while the flu virus are circulating, even after January. There are many locations to receive your flu vaccine, such as your healthcare provider's office, your local health departments, the federally qualified health centers, and your local pharmacies. Visit NJ.gov/health and make plans for you and your family to get your flu vaccines today. Moving on to my daily report, as the governor shared, our hospitals reported 420 hospitalizations of COVID-19 positive patients and persons under investigation. 91 individuals are in critical care, and 45% of those patients are on ventilators. There are no new reports of multisystem inflammatory syndrome in children. There are 57 total cases in our state. The governor reviewed the new cases and deaths reported. In terms of deaths, the breakdown of deaths by race and ethnicity is as follows: white, 54.1, black, 18.3, Hispanic, 20.3, Asian, 5.5, other, 1.8. At the state veterans' homes, the numbers remain the same as they do at our psych hospitals. No, I'm going to correct myself. The psych hospitals are reporting 1 new patient testing positive at Ancora. The daily percent positivity of September 10th is New Jersey, 1.82. The northern part of the state reports 1.42. The central part of the state, 1.85. The southern part of the state, 2.84. That concludes my daily report. Stay safe and remember, for each other, for us all. Please take the call. Thank you.
Judy, thank you, and thank you for rushing straight from the 3.5-hour budget committee hearing to here. Thank you for that and for all. Thank you also for highlighting the racial inequities as you do virtually every day. And I'm happy to say that I was the last of the 6 Murphys, but as I promised to Dr. Tina Tan on Friday, I got my flu shot Saturday morning, so we're all on 100% compliance, and I promised I would not show up today if I had not done so. Thank you. Pat, there's a lot going on. Happily, I think less in compliance, but a lot going on meteorological front, wildfire front, any other front you've got, and thank you for everything.
Thank you, Governor. Good afternoon. Yes, to your point, the Rock received no reports from police departments over the weekend with regards to any EO violations. I know the governor also spoke with regards to the weather. Besides Tropical Storm Sally and Hurricane Paulette, we're monitoring 5 additional storms between the Atlantic and the Gulf, which obviously gives us some concern right now. We're not expecting an impact in New Jersey, but certainly monitoring those. We do, to the governor's other point about always wanting to help those around the nation, in addition to the forest fire crew that's out, they're working, just so you know, they started this morning on 24-hour shifts. They've been paired up with teams from Montana, Utah, and Texas. So to your point about everybody coming together from around the nation, that's who they're paired up with. We also have a member of our New Jersey Task Force 1 Urban Search and Rescue who's been dispatched to Louisiana to be part of the incident support team, which is under the auspices of FEMA to support the impacts of Tropical Storm Sally there. Oregon also has several requests in with regards to logistical support, so we're trying to balance monitoring the storms that are coming our way and not leaving ourselves vulnerable, but at the same time trying to support, regardless of where they are, those requests, whether that's in logistics, whether that's in planning, whether that's in any of those emergency support functions. So we are closely monitoring those, and where we can help, Governor, you know, we certainly will. Thank you.
Pat, a question. Task Force 1, are they back home? They
are back. They did basically a 3 to 4 day deployment down to South, and in relatively short order returned home. It was a good exercise. They mobilized quickly, but they're back and ready to support not only New Jersey but anybody else who may need them.
So putting aside your very rightful point that we want to help as much as we can our sister states, but we can't also be exposed back here. To that question, and I know firefighting apparatus and individuals are a scarce resource. Is there a way, and I'm picking Task Force 1 as an example, but are there other operational elements that we can support that are not necessarily firefighting, but somehow back and fill other obligations that frees up assets that Oregon or California may have at their disposal?
Definitely, even with regards to like the one of our Task Force 1 members that's down there, to support a team and be in charge of whether it's planning, logistics, any of those other emergency support functions, emergency services, to serve in that role. It frees up somebody from that state to not have to do it. And you may say, oh, it's only 1 or 2 people, but whether you're performing that function in the wake of them, whether you're out there assisting with preliminary damage assessments, which is a huge piece, and seeing if it's going to be a federal declaration. There are so many ways, and we have so many subject matter experts from New Jersey OEM and our partners that can support in more than just actually on the line with a fire hose or on a boat with a swift water rescue. We can help in so many ways. Thank you, Governor.
I was with Tom Von Essen on Friday at the September 11th Memorial in New York, and he was singing our OEM praises and
thank you
and whatnot. So okay. So make sure, one thing is, I said this, and I know we all echo this, please God they're safe wherever they're deployed for whatever the reason. Thank you for that and for everything, Pat. I think we'll start over here. I think we're going to go back to a Monday, Wednesday, Friday this week, unless Dan Bryan corrects me. And White House, I don't think, is going to have another VTC until a week from today. So we will be almost certainly Monday, Wednesday, Friday, 1 p.m. here, and we'll be virtual Tuesday and Thursday unless we think there's cause to gather, in which case Dan or colleagues will pull it together. Mahan Gunaratne got married on Saturday. That's news. I was there myself. Tammy and I were there and saw it with our own eyes. It was a wonderful, blessed event, notwithstanding the fact that his wife Erin's family has had some tragedy in their family, but it was a very special occasion. So hats off to our colleague Mahan. And with that, Matt Arca, we'll start with you. Good afternoon.
Good afternoon, Governor. At least 6 school districts have already had to alter in-person learning plans after staff and students tested positive just days into their school years. Is this more than you expected so soon? How many districts have reported cases to the state so far? And how is the contact tracing going on these efforts? Similarly, what do you make of Rowan and emergency management officials have an emergency meeting later this week to talk about a surge in cases there? Real quick, want to get your reaction on New Jersey federal lawmakers saying that they won't provide emergency reimbursement for school systems and local governments for cloths, masks, and other PPE, and doing things like cleaning at schools and at state buildings. And finally, from NJ.TV, Make the Road is calling on your administration to offer immediate pandemic relief to undocumented immigrants, to eliminate rent payments, and to provide, more protections for frontline workers. How do you respond to their calls?
Matt, before Dante takes the mic, Dante, thank you. Who said they weren't going to reimburse the federal lawmakers from New Jersey or federal lawmakers?
New Jersey's federal lawmakers, yes.
Meaning they would not pursue more federal support?
Well, I guess that they're saying that FEMA is no longer going to provide the support.
Okay. Thank you for that. So I'll go to the top. Is this more than we expected? I think it's about what we expected, and I think, and again, Judy, tell me, you or Ed, if you disagree. I still don't believe we're aware of any in-school transmission, but if that's not the case, please correct the record. And secondly, it feels to me, I'd say quite strongly that the system is working, that steps are being taken as they should be. Ed?
Right. At this point, I would agree. No, we are not aware of any in-school transmission of cases. We can't absolutely guarantee that couldn't have happened, but we do not know of any. You know, if you start with, what do we have, 1.4 million students or something, K-12 students in the state, we certainly assume and know that some of them are going to test positive, and it shows that people are being tested and doing what they're supposed to be doing.
Contact tracing, I would assume for the K through 12 crowd is about consistent with the contact tracing experience we're having overall, I would think, right? There's no any evidence to say it's either more or less robust?
Well, actually, the schools are doing, I think, an excellent job in the contact tracing. Ed gets those reports as well. If you want to make a comment, they're really working it.
Yes, and absolutely, I would agree. And, you know, not a K through 12 school, but as you mentioned, Rowan is working extremely well with the local health department and us as well, as far as the increase of cases that they've seen there. So yes, absolutely, throughout the system, the schools, K through 12 as well as higher education, are certainly doing the best they can.
Yeah, I want to withdraw part of my comment. It seems to me, given the way the schools that have some form of in-person, whether it's full or hybrid, again, the evidence is they've done an extraordinary job preparing for what, again, everybody remember, this is not a normal school year, and number two, there are going to be people who test positive for COVID. The question is, how quickly can we get our arms around it, figure out, et cetera. But I will correct my own record and say, at least in the K through 12 piece, the ability to track things down is actually, the system feels very robust. Ed, you mentioned Rowan, and Matt had asked about any other color on Rowan?
I don't have anything more.
As has been reported, Rowan has seen an increase in cases, mostly in their localities, their off-campus housing and so forth. They haven't been able to trace it to any single event. There have been some parties and other things. Anytime you have large groups of young people gathering, you expect some of that to happen, although we certainly are very much encouraging that not to happen. There hasn't been any single, 600-person gathering or anything along those lines that it could be traced back to. But they are working very closely, like I said, with the local health department and through them with us to do their best to get out messaging and get this under control.
Matt, I've got no color on the federal delegation other than we've got a great delegation, but I think there's a broad consensus. I think it's a unanimous consensus, at least on the Democratic side of the aisle, that we are overwhelmingly in need of more federal support. And I can't say for sure, not for sure, but I can't say specifically there's a distinction in their perspective between PPE, et cetera, versus direct aid that we can then deploy through OEM or wherever, but there's an overwhelming view that we're short and we're meaningfully short, and that needs to get addressed and corrected sooner than later. And I'd probably have a similar reaction to the Make the Road. I haven't seen that, but I have complete sympathy, but we're in an extraordinarily challenging budget within the state, and we're doing everything we can to get that balanced over the next couple of weeks, and that's about what we've got to get that done. But separately, getting federal cash, again, we could spread into an enormous amount of needs across the state, across the spectrum of the state, including in our immigrant communities. So thank you for that. Alex, there was someone there, but I think they've left. Is that right?
Yes. Yeah, I don't know where they went.
Okay.
Good afternoon, Governor.
Hey.
First, for Dr. Lifshitz, just a clarification of something you just said. You're not aware of any in-school transmission of COVID now, but isn't that a better question to ask you in about a week or two? Isn't it going to take some time to see if there is in-school transmission? And the governor said it'll happen eventually, right? Just want to clarify on that point. For Commissioner Persicelli, I want to ask you a little bit more about the idea of the twindemic. Do you have any numbers? Could we see about as many cases of the flu as we do of COVID? And are you worried about stress on the testing regime? Because people who have flu-like symptoms will obviously want to know, is it flu or is it COVID? And do you also worry that people sending workers home or students home could put stress on businesses, food, and the schools when that occurs? And lastly, for the governor, I just wanted to ask you again about the financial services tax, the bill by Assemblyman McKeon. I wanted to see if you'd heard or had any reaction to the report that the New York Stock Exchange might move its data servers out of New Jersey if that bill goes through. I believe you've expressed support for it. Just wanted to see that you're still supportive of that, and what would the money taken in by that be used for?
So Ed, you should address the first one, but I would say we have said this is not going to be a normal school year, and there will be COVID positive cases. It's just that's almost inevitable, I think. Is that too strong a statement?
No, there definitely will be and have been COVID-related cases, as well as it is likely at some point there will be some in-school transmission. You are absolutely correct, of course, that the longer that we wait and see, the more likely that is to happen, and we're always, this is the reason why we set up these surveillance systems. This is the reason why we put out all this information to the schools, and the schools work with the local health departments and so forth, is first off to do everything that is reasonable to prevent that from happening in the first place, but second off, realizing that when it does happen, it can be spotted as quickly as possible and actions can be taken to keep it from spreading further.
Judy, anything else on the twindemic? The Southern Hemisphere experience with the flu feels like it was a better experience than a normal year. Does that give you any optimism?
That's an excellent point, Governor. The Southern Hemisphere reported lower flu because of all the safeguardings for COVID-19. We can only hope that that's the same experience that we have. And you're absolutely correct. Flu-like symptoms are very similar to COVID-like symptoms. And our emergency rooms do, during December or January, get really flooded with individuals with flu-like symptoms. So point-of-care testing, immediate testing, is going to be very important, primarily in physician offices and in emergency rooms. I think we have a quick flu test, don't we, that they can administer in our emergency rooms?
Yes, there is a rapid flu test, somewhat similar to the rapid COVID tests that are out there now as far as antigen testing goes.
Nothing, sorry, please.
For all the comments you made, I mean, that's why we're starting to warn people now, get vaccinated. What we don't want to see is a really bad flu season with a resurgence of COVID. It would stress our systems terribly, but I do have to tell you that we're planning for it.
Nothing really new in the financial services tax other than I continue conceptually to like it. I would hope that we could have a common ground discussion with the relative stakeholders, relevant stakeholders, pardon me. And as much as it's appealing and we're working on it, and I know the spirit with our legislative colleagues generally and specifically to that is a good one, but we don't feel comfortable so-called scoring it because there's too much uncertainty around it. But as a conceptual matter, we like it and would like to think we could find some common ground with the respective stakeholders. Sir, you good? You're good. I think we're going to Dustin, please. Dustin, good afternoon.
Good afternoon. When will we know what eligible people will have to do to claim the additional $300 in benefits approved by FEMA? And did New Jersey apply for a second round of benefits for another 6 weeks, or did we miss the cutoff, which would mean only allowing workers to earn 3 weeks of benefits? This morning you had more long lines at motor vehicles after you announced changes designed to keep the lines down. Any comment on that and any reasons for the backup? And then for the health commissioner, you said this morning that the state is going to launch a pilot next week on college campuses for contact tracing, where if you test positive, the people who have been around you for 6 feet will be pinged. Will this be tracking people's movements? Can you tell us more about that pilot on college campuses and how you'll ensure that people's location data is protected? How will it work? Does everyone need to have an app downloaded already? Things like that. Thank you.
Thank you, Dustin. So I'll defer to Matt Plackett, and we may come back to you on the $300 question. If there's money there and we feel like we can get it for folks who are unemployed, whether it's through unemployment insurance, through the FEMA piece, which is far more complicated, the much easier, straightforward fix here is to extend that $600 benefit through Congress, signed by the president. But if there's money available, we will do everything we can to get it, and that includes this tranche and any other prospective tranches. But what I don't have is a specific time on the 300. I think we're going to need to come back to you on that. Is that fair to say? Yeah. We're going to come back to you on that if we could. Dan, will you help me out, please? But if there's money available, we'll do everything we can to get it for our folks. No specific reason that I'm aware of this morning in MVC that was unique to this morning, unless my colleagues have any other insights. Listen, it's not, I wish it were a light switch. I thought our discussion Friday was a really good one in terms of the laws that we signed as recently as last Thursday night. Continue to strongly not just ask for patience, and we understand your frustration and we don't blame you, but also go online and just make sure you can't do online what you think you need to do in person. And I didn't get the readout from Sue Fulton on her connection with Rosa, but I know she followed up. But that's the one thing I know that can relieve the burden right now is if you can do it online, do it online. And again, we're not going to dig out. We didn't come into this overnight, and we're not going to leave this overnight. But God willing, we'll get there sooner than later. I know what the horizon looks like in MVC, and it looks really attractive. But if you're sitting in line right now, that's little solace to you, and I don't blame you. Department of Health, the commissioner herself is here. The college pilot on contact tracing.
Yeah, we hope to kick that off next week. We'll be testing it on 3 or 4 college campuses. New York, Pennsylvania, and Delaware are also bringing up the same digital notification app. So we've been doing most of our planning with them. They may announce a statewide rollout. We've decided to test it first on college campuses, see how it works, take care of any bugs we might find, any technical issues, and check the privacy aspects of the app itself.
Okay. Sir, how are you? Welcome back. We haven't seen you in a while.
Appreciate it, Governor. Good afternoon. Some rural Burlington County municipalities have sections without high-speed internet access or internet access in general. There are students in these areas who, for the most part, are on remote or hybrid learning schedules. One town in a recent BPU filing or petition filing said that children are being deprived of their right to a thorough and efficient education because of these circumstances. My questions are, what steps are you taking to bring internet access to these rural communities? Have you issued any mandates in this regard, and are you considering any? Is it acceptable to you that in the 21st century there are still parts of the state without internet access? Thank you.
No, it should not be acceptable to anybody in this state or anywhere in America. We designated $54 million in federal money to address both device purchases as well as internet connectivity in the state. I would love, Dan, can we follow up after this? I'd love to get a couple of specific communities that you've got in mind afterward. I'd love to, because I don't have a specific answer for Community X, but I would love to follow up with you. And I'm not, I'm going to speak out of both sides of my mouth, if I may. I'm not happy at all with the existence of any digital divide, rural, urban, or suburban, right? Period. On the other hand, and having said that, I think if you look at what we are doing right now, not necessarily the state we inherited, so we inherited something that was not acceptable and has been obviously overwhelmingly exacerbated by homeschool, remote learning, a pandemic. But I don't think in that context that any state is doing as much as we are doing right now to close that. And it ain't going to be overnight. Thank you. We're good. Thank you. Nikita.
I'm sorry. He had a
Good afternoon.
Want to get to that?
We're good, Nikita. Sorry, you want to come up here and do the questions, or?
No, that's fine.
Just checking. I'm sorry.
So on Friday, Senator Mike Dougherty said that at a 9/11 ceremony on Friday morning, Senator Mike Doherty said that racism or systemic racism was not real. He called Black Lives Matter a Marxist organization and called the defund the police movement a bid to destabilize the country. I'm wondering if you have a reaction to that. And then further, some ballots will begin to be mailed this week, mainly those for military members and those living overseas, and some will start voting. Now, the reason I ask about this or bring this up is because Perth Amboy still does not have rules for its December 8th runoff. I'm wondering if you plan to issue an executive order to address their needs and whether or not you believe that voters there should have all the rules to an election before they vote. And then I also have a question from Dan Munoz over at NJ Biz.
Will you tell him we miss him?
Well, I'm sure he's watching. So. He asks, a CDC report over the weekend showed that COVID-positive patients were twice as likely to say they did sit-down dining, regardless of indoors or outdoors.
So they were twice as likely to do what?
To say that they did sit-down dining, whether indoors or outdoors.
Okay.
Do you have any thoughts on the data? And has any data from the state for outdoor dining reflected that increase since June? And what about indoor dining? Has that been linked to any increases in transmission, positivity, or hospitalizations?
I'm not sure I 100% understand Daniel's, but I'll give it a shot. I didn't see Senator Doherty's comments in total, but I did see enough to say on any day to deny systemic racism. Am I right in saying that that's what he was essentially saying, there was no systemic racism? On any day that is not on. It is completely in the face of the overwhelming facts that are centuries old. Never mind saying that on 9/11, which is just takes your breath away. I don't know what country or what state he's looking at, but it's not the reality that exists. And again, year one, 5th century, since slavery came to our shores, sadly and with the heaviest of hearts, notwithstanding that we are the greatest nation on earth, which we are far from perfect, and we continue to dig out every single day from the stain of racism that exists very much in our country and in our state. Was the question related to the ballots going out this week connected to the Perth Amboy question?
Yes, it was just show ballots are going out.
Yep.
And
And you're saying should you have rules in place before they?
Yeah. So the runway is running out. Essentially, is the reason I bring that up.
I don't have any specific conceptually, yes, but Matt, any you'd add to that? I want to come back to you and reflect on that. So Daniel is saying that, if I got this right, we're going to channel Daniel here, that the CDC has said that among COVID-positive patients, there's been a higher incidence of dining either inside or outside. Did I get that right?
Yeah, based on what he sent me, he said that patients who were COVID positive were twice as likely to have eaten either outdoors or indoors at a restaurant.
So I've got two experts to my right, and I will just say that I want to repeat what I've been saying, I think we've been saying for 6 months, which is outdoors, this is a lot less lethal than it is indoors. And I don't think we've got any evidence of any outbreaks coming out of outdoor dining. Secondly, and Ed will correct the record here, secondly, we took the step on indoor dining now 10 days ago, so Friday the 4th of September. We would not have taken that step with 25% capacity restrictions, et cetera. We knew we'd be taking on some amount of risk, but we would not have taken that step if we did not feel the risk was manageable. And on that one, I would guess it is too early to conclude one way or the other on the indoor piece. But I think it's overwhelmingly the case on outdoors that we've not seen anything. But with that, Ed.
Absolutely. I did read the CDC report. I don't have all the numbers in front of me. And of course, every state does it differently when they talk about opening up dining, so you're not always comparing apples to apples. We have always known, we've always been careful about close congregation without masks. We know that's an increased risk. As the governor has said, we have not seen any increase in cases specifically associated with outdoor dining as far as that goes. And yes, it is too early to say anything related to indoor dining as far as New Jersey goes. We have not yet heard of anything, but yes, it would be early to say, and certainly something we keep an eye on.
Ed, I don't want to put words in your mouth, but I'll bet you, without having seen the CDC report, if the indoor dining experience included bars that were not controlled as we are now controlling them, that may be the reason. But without seeing it, I can't say that for sure. So we're now, it's a good question to end on, because we're 10 days since indoor. We're now 12.
From their perspective at the local municipality level, what they're seeing, Governor?
So this is partly born out of just the back and forth that we've had as a team. We feel like, anecdotally, the compliance on the steps we've taken lately, gyms, schools, indoor, and indoor dining and indoor amusement, has been overwhelmingly good. But we also, I think, Pat, I don't want to put words in your mouth, you don't want to take that for granted. You want to make sure that we're drilling into this. And the police chiefs and the folks in the counties who have been responsible and have had to bear the burden of that compliance enforcement over the past 6 months have been terrific. And Jared Maples, thank you, Dan, Matt, the whole team. They've been terrific, but the MVPs are the millions of you out there who have just consistently done the right thing. When this started, when the weather got warm, when we're back to school and back to some of these other habits that we all want to get back to, you folks have been extraordinary. And that includes individuals as well as operators, owners of establishments, superintendents of schools, educators. It takes a village, and we don't get to the shape that we're in right now, which we can't take for granted without an all hands on deck extraordinary effort. So to each and every one of you, God bless you and thank you. If not before, we'll see you Wednesday at 1 p.m. Thank you.